Live from London, this is BBC News. Sir Keir Starmer warns the NHS is broken but not beaten after a damning report into the health service in England. The Prime Minister has described the health service as broken but not beaten after a review commissioned by his government concluded that the NHS in England was in serious trouble. The report by Lord Darzi, who is a surgeon, a former Labour minister, highlights declining productivity and patients being put at risk by ballooning waits and awful emergency services. Despite the damning findings, Sir Keir Starmer says there will be no extra money without reform. Well, before we talk more about this, let's take a closer look at some of the key findings today, because it found that if you turn up to A&E, it is likely that 100 people could be in front of you. It also found that there are around 14,000 avoidable deaths every year, and that the last time the NHS met the 62-day cancer treatment targets was 9 years ago, back in 2015. Well, let's speak to Dr. Andrew Meyerson, a junior A&E doctor in East London, an active campaigner for advocates for better pay and working conditions for junior doctors in the National Health Service. He's a member of the British Medical Association and the Unite Union. Welcome here to the programme. Do you share that overall assessment, first of all, from that report and for what Sir Keir Starmer was saying earlier today?
The results that and the conclusions that Lord Darzi came up with broadly are what most of us have known for quite some time, that the NHS has been defunded to a massive degree. We're talking about, relative to France and Germany, we've lost 40 billion a year, over 70 billion a year relative to Germany. We haven't invested in our NHS for a decade. And that is because of political decisions made by the last government. It is important for us to move care from hospital to the community. It's important for us to go from analog to digital, and it is very important for us to go from a model that treats only the worst sickness to one that actually can prevent sickness in the first place. All of that's really important, but all of that requires investment. And if you look back 10 years ago, when we were hitting these targets, the NHS still had an immense amount of resilience because of massive funding that was put into it from Labour in the early 2000s, to their credit. And we were performing among the best in the world. We were ranked the #1 healthcare system in the world 10 years ago. Not only that, it was the most efficient. We wasted the least amount of money. So anybody that says the NHS is a funding black hole, it has no idea what they're talking about.
So it has to have.
We've had a decade of funding cuts, a decade of cutting fat every single year. There's no more fat left to cut, and we have an £11.7 billion budget of capital infrastructure that is an emergency that needs to be fixed.
So it has to have more money, in your view, not just reform.
Far too many people here in the 6th wealthiest country are dying prematurely from cancer, from other illnesses, because we don't have the opportunity to treat them. And beyond that, record numbers of people are on sick leave because they can't work, because they have illnesses and conditions that need to be fixed, that we can fix if things were working well. But because of the decade of austerity, because of the underfunding, because of COVID, we haven't been able to. We need to have an adult conversation about this, and we need to not balance the budget on the backs of working people.
Well,
we need to ask the wealthy just to pay just a little bit more, and they can, in order so that wealthy people, when they have a heart attack, they can get an ambulance to hospital, because everybody deserves that.
Andrew, we are out of time, Andrew, but you say we need to start a conversation. That clearly has already started. So thank you very much for joining us on today's programme.